Hey, just stop worrying. If you have OCD, you probably don't need that advice whatsoever, really. OCD needs evidence-based treatment from specially trained therapists who really understand what's going on. And that's why we created NOCD. I'm Dr. Patrick McGrath. I'm the Chief Clinical Officer at NOCD. Now, some of you may recognize me from our Get to Know OCD podcast, as well as the educational content that we do. But today I wanted to jump in here and talk about what my team and all of our therapists do here at NOCD. Before I get into that, though, let's cover what OCD is. Obsessive compulsive disorder. It's two things. It's obsessions and compulsions. What's an obsession? An intrusive, or maybe we feel inappropriate or unwanted thought or image or urge. And what is a compulsion? Some kind of act that we do to neutralize it. It could be something we see, like maybe hand washing, many people are familiar with, but maybe something we don't see, like saying a prayer over and over again until it's just right. That's OCD. And it's very difficult and debilitating, but there is hope. We have highly trained, great therapists who understand what evidence-based treatment for OCD is, and it's ERP, or exposure and response prevention therapy. It's a type of specialized therapy that really helps people not be distressed by their intrusive thoughts so they can start living the life that they want to live and not the life that OCD wants for them. It was really developed specifically for OCD, which is what makes it so really effective. And before NOCD, this effective treatment was hard to access. There were often long wait times, high costs, and therapists who specialized in OCD were often just in cities and in major areas. Individuals in rural places had real hard time getting the help that they needed. And if they were going to get it, they were traveling for hours and hours just to be able to go to a 1-hour session. We tried to change that. We know that there are many therapists out there who say they treat OCD, but they don't actually have the training that they need to truly understand it. This isn't because therapists don't want to learn about OCD, but rather because OCD training can be difficult to get or expensive. It can be long wait times to be able to get the training, and if you didn't cover it in graduate school, well, you might think that you learned everything that you needed to know, which isn't necessarily the case. It can cost lots of money and weeks of training to fully learn the intricacies of obsessive compulsive disorder, sometimes in the tens of thousands of dollars to be able to learn this. And to learn how to really effectively treat OCD, not only are we dealing with the learning about ERP, but then the practicums and the supervision that's involved. This is a long period of time. The lack of access to training then leads some to have really negative experiences in therapy because someone may advertise themselves as an OCD expert along with 27 other things that they say they're experts in when they really aren't. Many people have told me about going to therapists who provided them with reassurance, who unknowingly encouraged them to engage in compulsions, which is exactly what OCD wants, and it makes OCD worse. And when you're already struggling with a condition that can be so debilitating and have so many negative experiences like these, that can make you completely give up hope and maybe not even want to go back to treatment at all. Once had someone share with me that their former therapist even called Child Protective Services on them over OCD intrusive thoughts. We know that OCD can be intrusive in areas like pedophilia or perinatal concerns. And these are not people who want to do any harm whatsoever. They're afraid of what if I were to do something. This is just horrible then that people would make calls on individuals who are suffering like this. And it shows how improper treatment of OCD and not knowing what OCD is can really make things worse. Even if someone were to find a clinician who did understand OCD and its nuances, getting started with treatment would often take a long time due to lengthy wait lists and high costs. In fact, I know OCD experts out there who have almost a year waiting list and can charge over $400 a session. This is just a few examples of the issues that I've seen in my career, and that quite frankly frustrates me because OCD is terrible. That's why I joined NOCD as the Chief Clinical Officer, to transform the state of obsessive compulsive disorder treatment by ensuring that more therapists have access to the proper training that equips them to accurately diagnose and effectively treat obsessive compulsive disorder. To make that happen, I helped develop NOCD's world-class therapist training program. Here are the 4 key components of our training and what makes it different from others. The first step is a very selective interview process. Therapists have to have an advanced degree, a valid license, and significant experience with one-on-one therapy to even be considered. And then they must pass our super detailed interview process to show they have what it takes to be a great therapist for people with OCD. It's empathy, cultural awareness, and the ability to build relationships with people of all backgrounds, along with knowledge of what OCD is. Step 2 is our training. NOCD therapists go through an intensive 3-month training program that equips them to deeply understand what OCD is, the symptoms, the subtypes, effective treatment, and exposure and response prevention therapy. They have to show they can properly treat OCD and related conditions, and they have to provide personalized and inclusive care. The next step, testing. As part of our training of our therapists, all of them must pass rigorous exams, do mock therapy sessions, and they're going to meet with our expert clinical leaders before they see members. Step 4 is continuous learning. Our therapists receive ongoing training, routine evaluations, and really consistent oversight from myself and our team of expert clinical leaders throughout their entire time that they practice with us at NOCD to ensure you are getting the best treatment possible. And NOCD therapists accept many major insurance plans, making it more affordable for our members to access and receive what they need the most: effective treatment. If you're living with OCD, you can get better. With specialized treatment from a trained therapist, you can learn to manage your OCD symptoms and put yourself, not your OCD, in the driver's seat of your life. That's what we want for you. If you're ready to start therapy for obsessive compulsive disorder, or you have any questions about treatment, what I want you to do is go to NOCD.com. That's NOCD.com, NOCD.com today to schedule a free 15-minute call with our team. On your call, well, we're going to listen to what you're experiencing and answer any questions that you have, and we're going to match you with a licensed, specially trained NOCD therapist so that you can really start talking with someone who is going to help you get your life back. I hope to hear from you soon.